Hello everyone and welcome to this tutorial about antihypertensive drugs. The objectives of this tutorial are to discuss the different types of antihypertensives. We'll talk about ACE inhibitors, beta blockers and calcium channel blockers. All fancy names, but we'll explain a little bit more about them. So ACE inhibitors, they are drugs that end in the letters IL. So you may have heard of drugs called ramipril, lisinopril, perindopril. All of these drugs end in IL. These drugs lower the blood pressure by decreasing peripheral vascular resistance. So this means it relaxes the blood vessels basically. And they inhibit or block the angiotensin converting enzyme, which is what ACE stands for. That's why they're called ACE inhibitors. So this lowers the blood pressure by stopping the conversion of angiotensin 1 to angiotensin 2. And there's also a decreased secretion of aldosterone, which reduces sodium and water retention. Another drug that we will look at is beta blockers. Beta blockers end in the word olol. So we have drugs such as metoprolol, atenolol, bisoprolol. These are all beta blockers. Beta blockers they block the beta adrenoreceptor sites located in the heart, in the bronchi and the blood vessels. Don't stress too much about this. What you need to know is that the effects of this are a decrease in heart rate, so the heart rate goes down, and the blood pressure goes down as well. So myocardial refers to heart, pumping of the heart. Cardiac output is your blood pressure. This decreases. We need to be very aware. We've got a red flag here that I'm drawing. If we have a patient who is on a drug ending in olol, a beta blocker such as metoprolol, bisoprolol, atenolol, we need to be checking their heart rate and blood pressure before we give their medication to make sure it's not too low. Then there's also calcium channel blockers. These block the calcium channels. So they prevent calcium from entering the myocardial cells and walls of the blood vessels. The effects of this, are variable according to the tissues and cells, cardiac muscle, SA, AV node. These are nodes in your heart which are responsible for electrical impulses. Essentially, calcium channel blockers decrease the force of the contraction in the heart, which in turn reduces blood pressure. So calcium channel blockers reduce blood pressure. Thank you for listening to this brief tutorial.